The problems that affect the elderly diabetics and their treatment. A person who's been diagnosed with diabetes needs to take very good care of themselves. But this can be much harder for an elderly patient to do for various other reasons, including but not limited to home situation, cognitive abilities, comorbidities, other medications. Of course, as older adults with diabetes, the importance of their health needs to focus on nutrition and avoid becoming hypoglycemic. After all, as people age, they don't eat near as often, putting them at risk for malnutrition and hypoglycemia. Now, most diabetes treatment guidelines are geared toward people in their middle ages, with the same recommendations for everybody, young and old. However, it's important that elderly diabetics get an individualized plan that's tailored to their particular situation. The life expectancy for a man in the U.S. is 88 years old, while the life expectancy for a U.S. female is 90 years old. People classify the elderly into two categories: young old, those who are between 65 and 80 years of age; old, people who are older than 80 years of age. Of course, these categories are too simplistic to the elderly, and diabetes can affect them much more differently than a person who's much younger than themselves. Since an individualized plan is highly recommended for older diabetic patients, what are the primary issues that a doctor must consider when developing the plan? Cognitive dysfunction. Diabetes is tied to a host of other medical conditions for older adults. Geriatric syndromes are the culmination of various conditions such as cognitive dysfunction, functional impairment, and others. These conditions can affect how well a person with diabetes can care for themselves. Cognitive dysfunction such as Alzheimer's disease, dementia, and others are 2 times more likely to affect a person with diabetes. These conditions can range from subtleness to complete memory loss. This means a person who has diabetes and a decline in their cognitive abilities will be unable to properly care for themselves, such as testing, changing doses of insulin, and taking care of their diet. For that reason, older diabetic patient caregivers are advised to keep constant track of the diabetes patient and monitor their blood sugar levels to reduce the chance of hypoglycemia. Functional impairment. Another problem is their functional impairment. Older diabetics tend to be less active and suffer from more functional impairment. They may have difficulty with hearing and seeing, may have balance issues, suffer from peripheral neuropathy, loss of feeling in their extremities, and so much more. These problems can limit a diabetic from getting the physical activity they need to stay healthy and keep their blood sugar down. Unique nutritional needs. The nutritional needs of older diabetics patients are especially important, though it's important for any diabetes patient regardless of their age. As a person ages, their energy needs begin to drop, but their macronutrient needs stay the same. It can be very difficult to meet these macronutrient needs if a person isn't consuming enough calories. It's not uncommon for older adults to suffer from swallowing difficulties, anorexia, altered tastes, and others. This is why doctors are advised to create a mini nutritional assessment for older adults with diabetes, either with the patient or with their caregiver and a nutritionist. The plan needs to take into consideration goals, preferences, their culture, and abilities. These are just 3 of the many things doctors with older diabetic patients need to consider when treating their patients.